What is the cause of idiopathic scoliosis? Scoliosis is the development of an unnatural sideways bending curvature. And the scoliosis also, the spine twists or turns into the concavity of the scoliosis, making it a true three-dimensional condition. Now, scoliosis is a progressive condition, so in its very nature to worsen over time. And we know scoliosis ranges in severity from mild to moderate to severe to very severe, making scoliosis not only progressive, but it can become very progressive in very specific types of development, specifically pubescent growth spurts. And this is what normally triggers rapid progression in the adolescent case. In adult cases, we don't expect rapid progression. It tends to be more slow and steady and compressive over time, but there is an increase of the rate of progression in later stage life. There are different types of scoliosis, and scoliosis types are typically determined by the causation. And the most common type of scoliosis is something called idiopathic scoliosis, which we'll talk about in a second. But there are also other types of scoliosis cases, and one type is something called neuromuscular scoliosis. And neuromuscular scoliosis is when there is the presence of a larger neuromuscular condition, something like cerebral palsy, Marfan syndrome, neurofibromatosis, or something along those lines, and the person develops a scoliosis as well. If you have one of these conditions and you have scoliosis, they will diagnose it or classify it as a neuromuscular scoliosis. Degenerative scoliosis is an adult-onset type of scoliosis that occurs when the spine unnaturally degenerates in a certain area, typically the lumbar spine, and this degeneration is asymmetrical, leading to a curvature. And this is normally diagnosed in the 60 to 70 year age range, and normally pain is what brings on, and stiffness tends to bring on the diagnosis. Congenital scoliosis is when you're physically born with scoliosis, and this is when a malformation occurs to one of the vertebrae of the spine in utero, and you're born with a scoliosis, but the scoliosis actually develops in utero, and this is called congenital scoliosis. Now, sometimes these types of curvatures can also cause an atypical curve, meaning in most idiopathic cases, we'll have a left lumbar and a right thoracic scoliosis. In these cases, we can see the opposite. We can see a right lumbar and a left thoracic. And this means that the spine can bend towards the heart and the thoracic spine. And that's normally a feature that doesn't occur in an idiopathic scoliosis. Now, idiopathic scoliosis is basically the diagnosis that's given to patients if you don't have one of the other four. So if you don't have degenerative, you don't have congenital, you don't have neuromuscular, right? They're going to say that now you have idiopathic scoliosis. And that is what to say, we don't know what's causing it, that the scoliosis is not associated with any single cause. And we believe idiopathic scoliosis to be considered a multifactorial condition, meaning there's many different combinations of variables that can differ from one patient to the other, another patient that is leading and developing their scoliosis. We know idiopathic scoliosis comprises the majority of cases. 80+% of cases are diagnosed with idiopathic scoliosis. The other 20% is a combination of the other four that I mentioned. Now, idiopathic scoliosis, there tends to be a lot of talk about genetics. My sister has scoliosis and I have scoliosis, and we do see family members that have scoliosis running in the family, but there is no specific evidence to say that it is genetic. And the reason why is because they've done studies on identical twins, and they've only found about 60% of identical twins to both share scoliosis. So despite all the research that we have, there has not been one specific gene or any type of gene mutation that accounts for development of scoliosis hasn't really been identified. But we do know scoliosis is familiar, because even though 40% of identical twins don't share scoliosis, 60% do. So there is a genetic factor, but not just a genetic cause, because if it was 100% genetic, every set of identical twins would both share scoliosis. We do see it familiar though, meaning if somebody in the family has it, it is more than likely somebody else in the family is going to have it. But there are other things that families share other than genetics. They share a diet and lifestyle, body type. There's social and economic factors. There's developmental factors. There's location, stress responses, and we really don't know. So therefore, having another family member doesn't always guarantee somebody else is going to have it, but it definitely is more likely to develop. Now, if we don't know the cause of idiopathic scoliosis, Can we treat it? And this is one of the most common questions that get asked is, how can you treat scoliosis if you don't know the cause? Well, the majority of times, not knowing the cause doesn't alter our treatment. Meaning, because by the time we find scoliosis in the majority of cases, we're not finding it when it becomes right when it onsets, especially in adolescent cases. Normally it's onsetting very young, sometime in juvenile years, probably about 5 or 6 years old, starts off very small. And as after it progresses during growth is when we find it. Typically the average size of diagnosis is somewhere between 25 and 35 degrees. So by the time we see a scoliosis, the curves already become structural in nature. As it's progressed because of growth, not because of what caused it, is when we find it. And therefore, we have to address the structural nature despite whatever caused it. And I'd always like to talk about this type of concept is, imagine if the scoliosis was an onset as a result of some type of vitamin deficiency. Let's just say it was a lack of vitamin D, and that initiated a very small curvature. And as a result of it, now the patient is given vitamin D and they still have this 5-degree curve. And now they go into their adolescent stage and they start to grow. The curve is growing, not because they're still deficient in vitamin D, is because they're just growing and they have a curve, and when they grow, the curve gets bigger. And so therefore, what causes the progression isn't what caused it initially in majority of cases, is the fact that just growing with a curve. You can give the person right now all the vitamin D they possibly need. The curve isn't resolving because it's structural in nature. And that's what we look at when it comes to scoliosis, that even though we know it's uncurable and we don't know the causes of majority of cases, and we do know it's progressive during growth, but it's definitely treatable. Meaning if we treat scoliosis early and we definitely look at managing scoliosis during this growth stage before it becomes very large and severe, we can have much greater treatment outcomes. Now, we know there's never any guarantee when it comes to treatment, but when we detect it early and we respond with proactive treatment, we know we can get significant improvements and reductions in idiopathic scoliosis. And there's a very host of conservative approaches that offer non-surgical treatment options with very specific proven results. And when we look at conservative treatment options, we look at the combination of combining multiple treatment options into a very scoliosis-specific treatment. And that becomes scoliosis-specific types of chiropractic care, scoliosis-specific types of physical therapy, corrective bracing, scoliosis rehabilitation, neuromuscular education. And these therapies and treatments are combined uniquely for the person and how they present to provide the very best results possible. Here at the Scoliosis Reduction Center, our patients benefit from this type of proactive, conservative treatment approach to try to get the curves to reduce. So we don't always know what causes a scoliosis, but we do know we can treat it successfully, because no matter what the cause, even in cases like neuromuscular scoliosis that we associate the causation with a neuromuscular condition, we treat the scoliosis structurally. We don't treat the neuromuscular condition and the scoliosis gets better. We have to reduce the curve on a structural level. So even if we did know the cause, it probably wouldn't alter how we treat it, because we're always treating scoliosis structurally to get the very best result possible. And once we find the structural thing, the most important factor is, once we diagnose it, is that we respond with treatment early as possible, because the earlier the treatment, the better the results. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.